Given the limited international literature on this topic, I focused on China as an example to describe the current status and the challenges of urokinase thrombolysis for acute ischemic stroke. And stroke has been the leading cause of death and disabilities in China since 2013, and with ischemic stroke account for over 25% of cases. And given the regional economic imbalance in China has resulted in disparities in access to acute ischemic stroke care. And while TPA and TNK-based thrombolysis and mechanical thrombectomy are frequently utilized in eastern coastal areas, the ability of these treatments may be restricted in central and western regions of China, as well as the rural area of these eastern province. And despite China's overall economic growth and roughly 600 million of our citizens, which is nearly half of our country's population, earn only about 1,000 yuan per month. Yeah, it's about $139. As we all know that the TPA drugs cost around 6,000 yuan, which is nearly $1,000, and this is just one part of the overall treatments for acute ischemic stroke, making it prohibitively expensive for many patients in China, and especially in the middle and western part of China. So the financial burden, unfortunately, put effective treatment out of reach for large segment of our population, and has led us to carefully evaluate the alternative approach. In addition to TPA and TNK and other emerging thrombolytic agents, urokinase as the first generation thrombolysis agent provide a valuable alternative. It works through a straightforward, effective mechanism with a half-life of approximately 20 minutes and primarily metabolized by the liver. Urokinase has demonstrated reliable therapeutic effects, leading to its FDA approved for thrombolytic disorders. Against these backgrounds, China has accumulated substantial experience with urokinase thrombolysis in the treatment of acute ischemic stroke. Yeah, however, the majority of this research has been published in Chinese language journals, limiting its disseminations and recognition within the international scientific community. Yeah, I will now present briefly about an overview of research and clinical experience with urokinase thrombolysis in China. And from 2001, during the next 5-year plan in China, the Chinese government has sponsored a study to investigate intravenous thrombolysis for acute ischemic stroke within 6 hours. And in the first phase of the trial, an open-label, single-arm study was conducted, and a total of 409 patients was included. And the results showed that urokinase was, if administered intravenous over 30 minutes infusion, the dosing range was established between 0.5 and 1.5 million IU with a mean administered dose of 1.31 million IU. And the result was highly encouraging. The symptomatic intracranial hemorrhage rate was 3.91%, and the the value was lower than reported for the ITPA thrombolysis. And based on the promising result of the first phase trial, in the second phase, initiated in 2002, employed a more rigorous multi-center randomized clinical trial with 465 patients. The study included 3 treatment groups, and Group A received 150 million IU urokinase, and Group B received 100 million IU, and Group C received a placebo. And the results showed that the functional independence at 90 days was much higher in the high dose group, and which is the lowest in the placebo group, while the incidence of a symptomatic intracranial hemorrhage was similar, respectively, in the through treatment group. And so, since its initial inclusion in the 2002, Chinese National Stroke Guidelines has consistently recommended intravenous urokinase thrombolysis for acute ischemic stroke patients within 6 hours of symptom onset. Recommended dose protocol was 100 million and 150 100 million IU over 30 minutes. And this protocol has remained unchanged through multiple guideline updates. And during the past 2 decades, the urokinase has been widely used for thrombolysis therapy of acute ischemic stroke, and a lot of exploration has been done, and some experience in the drug program has been accumulated. And lots of study has compared the safety and efficacy of urokinase to that of the RTPA, and several nationwide registry study, and there are also real-world evidence from a China Stroke Center Alliance database, and which in comparison over 13,905 patients used the urokinase case. And all these data show that there are similar efficacy between urokinase and RTPA. In addition, intravenous urokinase has also been investigated in combination with other therapies, including the early antiplatelet therapies after the urokinase thrombolysis, and in combination with anticoagulation therapy. And these evidence showed accessible safety profiles while delivering significant better outcomes for patients who achieved combination therapies. In summary, although 20 years of clinical experience and extensive research in China demonstrated that urokinase has a clear non-inferiority as a thrombolytic agent. Its efficacy and safety profile are comparable to those of new generations of thrombolytics. However, several challenges remains that are need to be solved. Literature evidence showed the safety and efficacy of urokinase used for patients with acute ischemic stroke, but the current guidelines recommend 100 to 1 and 100 million IU. But without weighted-based dosing, the specific administration is determined by physician experience, which can't guarantee the patient's safety and efficacy. Yet significant work remains, particularly in developing more precise personal dosing protocols, and in support of these goals, and we are actively investigating weight-based dosing protocol for urokinase, and we believe this research will particularly valuable for low and middle income countries seeking to implement cost-effective stroke management strategies. And we also encouraging and we also encourage global researchers interested in exploring affordable thrombolytic agents to join our efforts and our work.